So let's talk about where the strongest human evidence actually exists. If we are being honest about longevity, real honest, most of what people argue about online is actually happening in the margins. All these supplements, peptides, biohacks, cold plunges, red lights, a new molecule basically almost every week. Meanwhile, the biggest, most reproducible human evidence for living longer and staying functional is, unfortunately, painfully unsexy. It's the stuff that looks boring because it's been true for a long time. It basically comes down to 4 buckets: exercise, smoking cessation, blood pressure control, and metabolic health. Now, it's not because those are the only things that matter, obviously they're not, but because the real impact on our life is so huge. The evidence is really deep and the outcomes are just hard endpoints: cardiovascular events, cancer outcomes, disability, and mortality. Alright, so let's talk about exercise. And I don't mean the gym culture or trying to look like a fitness influencer. I'm talking about the clearest signal we have for how to live a longer life. If you look at the health research out there, being active is one of the best ways to predict who is going to live the longest. Now, a lot of this comes from watching how people live over many years. But the results are so consistent that it's just hard to ignore. It doesn't matter who you are or where you live. The more you move, the better your health gets. Now, here we are not even arguing if it helps anymore. We are just trying to figure out exactly how much credit the exercise itself deserves. When we look at the data, we see a very specific pattern. The absolute biggest boost to your health happens when you go from doing nothing to doing just a little bit. This is the, quotes, first step bonus. The research shows that the sweet spot for longevity starts with about 150 to 300 minutes of moderately intense activity per week. That's roughly 20 to 40 minutes a day. Now, what does it mean, moderate? Moderate means that your heart rate is up enough that you can talk, but not sing. Now, if you push it into the vigorous territory, where you can only say a few words at a time, you can get similar benefits in about half the time, roughly in about 75 to 150 minutes a week. Now, while doing more than this, like 10 hours a week, still provides benefits, the bang for your buck pretty much starts to level off. You don't necessarily hurt yourself by doing more, but for the average person, the extra hours don't add much more to your lifespan. And for a small group of extreme endurance athletes, there is some debate about whether the excessive high-intensity training might actually cause minor heart scarring. Though for about 99% of us, the biggest danger is really doing too little, not really doing too much. Now, if we are talking about the really maximizing our years of life, we have to look at our training zones. So there are 4 zones, and zone 1 is really the easy movement, like slight strolling, while zone 2 is the steady state, the all-day pace where you can still hold a conversation. Now, high-level longevity experts often recommend spending about 80% of your cardio time in zone 2 because it builds your cellular engine, your mitochondria, without burning you out. The other 20% should be the high-intensity work, like zone 4, where you are huffing and puffing. So this 80 to 20% split helps boost your VO2 max, which is really the single strongest predictor of how long you will live based on the current research. Now, achieving this zone 2 steady state doesn't require jogging or cycling. For many older adults, the most practical and evidence-based tool available is simply walking and speed walking. When we examine the large-scale cohort data, the survival benefits of walking are really tied tightly to two metrics: step volume and cadence, speed of walking. Now, peer-reviewed studies show that the steepest decline in all-cause mortality occurs up to approximately 7,500 to about 8,000 steps per day for somebody who is around 60 years old or older. Now, beyond this point, the relative risk reduction begins to level off significantly, meaning you don't need to walk indefinitely to capture the bulk of the longevity benefits. However, the step volume is only half of the equation. The intensity determines really the training zone. What I mean by that is that shifting from a casual stroll to a brisk speed walk and maintaining the speed at roughly about 100 steps per minute is really what safely elevates the heart rate into that mitochondrial building zone 2. Now, if you are looking for the best practices regarding timing, the absolute time of the day, whether morning or evening, has not really been shown significant when we look at the overall benefits of walking for the longevity purposes. The thing that does matter is what's called the meal timing. What I mean by that is basically incorporating a short 10 to 15 minute brisk walk immediately after your largest meal of the day. That will help the muscular contractions to clear the glucose from the bloodstream. Now, after meal walking can really significantly blunt the post-meal insulin spike and enhance the glycemic control. In other words, control of the blood sugar after the meals. And that serves as a direct mechanism to protect both your vascular lining and your metabolic health. Now, obviously, the specific heart rate numbers for these zones change as we get older, since your maximum heart rate naturally drops. The effort level remains the same regardless of age or gender. If you are 25 or 65, the goal is still to keep your heart and lungs challenged enough so that you can adapt without causing total exhaustion. Now, muscle matters just as much as cardio, but the zones work differently here. Instead of heart rate, we are really looking at the intensity and the time under tension. For longevity, you don't really need to be a bodybuilder, but you do need to challenge your muscles enough to keep them from wasting away as you age. Now, the data suggests that just 2 days a week of strength training can reduce your risk of death by about 10 to 20%. That's pretty huge number. This acts as a shield against the frailty and the falls, which are really the major longevity killers in later life. Now, when it comes to our joints, the fear of wear and tear is sometimes overblown. Now, peer-reviewed studies actually show that moderate running and lifting can strengthen your cartilage and bone density. The key is progressive overload, slowly adding weight or distance over time so our joints can have enough time to adapt. Now, if you go from the couch to a marathon in a week, so to speak, you will get hurt. If you build up slowly, you are actually building a more durable anti-aging frame. Alright, let's talk about the second bucket, and that's smoking. Honestly, this is one of the simplest things to talk about in medicine, but people still try to find excuses or loopholes to keep doing it. Here is the bottom line. Smoking is a huge reason people die way too early. And that's not just regular smoking, that's also secondhand smoking. If you quit, you gain years of your life back. It's better if you quit while you are young, but even if you are older, you still win. You are basically changing the math of your future for the better. But that being said, there's an important thing to keep in mind, and that's the benefit is not exactly the same for every person. It depends on few things. Things like how long you smoked, how many packs you went through, your general health, and your age. So instead of saying everyone gets exactly 5 more years, it's more like looking at the odds. Some people gain a little time, some gain a massive amount of time. But the earlier you stop, the better your chances are for those big wins. Now let's talk about another thing that you will hear a lot, and that's the damage is done, right? It is a myth that you will hear lots of people say, I've smoked for so long that the damage is already done, so why should I really bother? And that's just not true. As soon as you stop, your risk for disease really starts dropping. So your body's future looks a lot better the moment you put the cigarette down. Now, the third big thing is blood pressure. This is not as exciting as some of the new fancy health trends, but we have ton of proof that managing it helps you live longer. Think about blood pressure as more than just a number on a screen. It's a measure of how much stress and pressure your blood is putting on your pipes. When that pressure is too high, it causes wear and tear on your brain, kidneys, and your heart. We know for a fact that lowering high blood pressure prevents heart attacks and strokes because we have data from thousands of people proving it. So the real debate is not if it matters, because it definitely does, but rather the debate is about how low you should go. Now, the latest peer-reviewed data breaks it down into stages. You are considered normal if your reading is less than 120/80. Once the top number climbs between 120 and 129, while the bottom number stays under 80, you are in that elevated category, which is basically a yellow light telling you to pay attention. Now, stage 1 hypertension starts when the top number hits 130 to 139, or the bottom number is between 80 and 89. This is where the risk really starts to bake in, sort of. Stage 2 hypertension is anything over 140, over 90, or higher than that. If you ever see numbers hitting 180 over 120, that's hypertensive crisis. In this case, you need immediate medical help. Now, most people don't feel sick when their blood pressure is at 135/85, and that's why it's so dangerous. It's pretty much silent stressor that slowly damages your brain and kidneys while you feel perfectly fine. So let's talk about what optimal blood pressure really means, because this is where people get confused. Blood pressure of 120/80 is not some magical cliff where below it you are safe and above it you are doomed. Blood pressure risk works more like a slope. As the pressure rises, the long-term risk rises. As the pressure comes down, especially the top number, the long-term stress on the brain, kidneys, arteries, and heart usually comes down. The strongest observational data suggests that cardiovascular risk keeps dropping down to around 115/75, at least in the middle-aged and older adults. So from a pure longevity standpoint, person who naturally lives around 110 to 120 over 70 to 80 is generally in a very favorable zone. Now, there is the zone where blood vessels are under less mechanical stress day after day, year after year. But here is the nuance. Naturally being somewhere between 112/72 is not the same thing as forcing someone from say 123/85 down to say 110/70 with medication. Those are not identical situations. A natural low normal blood pressure is often marker of a healthier vascular system, which means better arterial flexibility, lower sympathetic tone, better fitness, lower visceral fat, better insulin sensitivity, better sleep, and less chronic inflammatory load. It's usually part of healthier physiology. Now, medication to lower blood pressure is different. It can absolutely save lives when blood pressure is truly high or when the person is at high cardiovascular risk. We have randomized trial data showing that treating higher risk adults more intensively can reduce cardiovascular events and mortality. So this is not anti-medication sort of statement. Medication works. The question is, who needs the medication? How low should we go, and what is the trade-off? For example, if someone is walking around with blood pressure 150/90, bringing that down is one of the most proven life-extending interventions in medicine. Again, we have to consider also the age and symptoms, but we're talking about general middle-aged person. Same thing if someone has hypertension plus kidney disease, diabetes, prior cardiovascular disease, high 10-year risk, or evidence of organ damage. In those people, getting closer to 120 range can be a very good thing if they tolerate it. But if someone is otherwise healthy and their real home average is something like 120/85, the decision is different. First, under the current United States categories, the bottom number of 85 is not truly perfect normal, in quotes. It falls into stage 1 hypertension because the diastolic blood pressure is between 80 to 89 by definition. But that does not automatically mean that the first thing should be starting medication. In a low-risk person, the first move is usually lifestyle, better measurement, and looking at what is driving the number. Is it poor sleep? Is it lots of stress, alcohol, weight gain, sodium, potassium balance? Is it low fitness or pain? Is it caffeine timing or poor recovery? Or is it masked hypertension, which we're going to talk about later? So is naturally 120/80 better than medication achieved 110/70 in a low-risk person? In general, yes. If your body naturally sits in that zone because your vessels, kidneys, autonomic system, and metabolism are healthy, that's ideal. But taking medication to push a low-risk person from mildly elevated number to very low numbers is not automatically better. You may gain very little absolute risk reduction and add side effects like dizziness, fatigue, electrolyte changes, kidney function changes, sexual side effects with some of those medications, cough with the ACE inhibitors class, ankle swelling with the calcium channel blockers like Norvasc, or orthostatic symptoms, especially when standing up quickly. So this is why blood pressure targets are not only about the numbers. They are about a person attached to that number. A strong, healthy 50-year-old with home average blood pressure of 118/74 is in great place. A 76-year-old with vascular disease and blood pressure 145/85 may benefit from medication lowering towards 120 if they can tolerate it without significant side effects, primarily dizziness in this age group. But for example, in 88-year-old person who is frail, dizzy, falling, and his blood pressure drops when he is standing up, this person should not be treated like a spreadsheet. In this person, the quote, optimal blood pressure may simply mean safe and stable, not aggressively low. So the practical longevity target for most adults is this. Try to live naturally around the 110s to low 120s of systolic blood pressure and around 70s of diastolic blood pressure. And that's without dizziness, fainting, kidney injury, or poor exercise tolerance. Now, if you already have hypertension or high cardiovascular risk, treatment below 130 over 80 is generally strongly supported by the evidence that we have from clinical trials. In selected people, closer to 120 of the systolic, the higher number, may be better if it is well tolerated. But the goal is not to win some kind of blood pressure contest. The goal is to reduce lifestyle pressure damage without creating new problems. So what actually moves blood pressure in real life besides just saying eat less salt? Now, don't take me wrong, salt matters, but the story is more nuanced. Salt sensitivity is really more common in African Americans, older adults, people with hypertension, kidney disease, and diabetes. But salt reduction is not useless in white adults either. The effect in that group is just variable. Some people respond a lot, some respond modestly, and some barely respond when they cut the salt intake. So the better strategy is not only less salt, but it's improving the whole blood pressure biology. So how does it look? Well, the highest impact dietary pattern is basically the so-called DASH style eating. DASH, dietary approaches to stop hypertension. What it means, what it translates to is basically it's a system, it's sort of like a diet that has been put together to help lower the blood pressure naturally through eating certain groups of foods. And these foods include things like fruits, vegetables, legumes, nuts, seeds, whole grains, and potassium-rich foods with less ultra-processed food. Now, the reason why this approach to lowering hypertension works is not only because the sodium intake goes down, it also increases potassium, magnesium, fiber, nitrite-rich plants, and other vascular supportive nutrients. Potassium is especially important because the sodium to potassium balance appears to matter more than the intake of sodium alone. But potassium should come mostly from food, not aggressive supplementation, especially in people with kidney disease or people taking the groups of medication called ACE inhibitors, ARBs, medication called spironolactone or similar medication. Now, exercise is another major factor. Regular aerobic training lowers resting blood pressure, but resistance training and isometric training also matter. One of the more interesting findings from newer meta-analysis is that isometric exercise, which are things like wall sits or hand grip training, these exercises can lower blood pressure meaningfully, sometimes even more than traditional exercise modes that we've been talking about for decades now. Now, that does not mean that wall sits or training the hand grip strength replaces things like walking, cardio, or strength training. It basically means that they can be added as a very efficient blood pressure lowering tool. And obviously, weight loss matter if someone is overweight, especially if they carry visceral abdominal fat. The fat that's surrounding our organs, not necessarily the fat under the skin. Now, this does not apply the same way to a lean person, but for someone with excess visceral fat, even 5% weight loss can move blood pressure, insulin resistance, inflammation, and sleep apnea risk in the right direction. So, another thing that really matters when we talk about what affects blood pressure meaningfully is alcohol. If someone drinks heavily, reducing alcohol can drop blood pressure in a dose-dependent way, meaning the less you drink, the more the blood pressure drops. But if someone already drinks very little or not at all, there's really not much to gain by stopping drinking all 100%, not drinking at all, okay, if you drink just a little bit. But sleep is another huge factor, and poor sleep, which is untreated, or sleep apnea, and chronic sympathetic overactivation, which in many cases goes along with poor sleep, can keep blood pressure elevated even when the diet itself looks really good. And this is why monitoring the morning blood pressure can be so revealing, and we're going to talk about that in a little bit later in this podcast. Stress management is very real as well, but it should not be oversold to the extreme. Meditation, slow breathing, yoga, and relaxation training can help some people, especially if their blood pressure is really driven by the sympathetic overactivation. But if someone has true hypertension from vascular stiffness, kidney disease, obesity, or sleep apnea, breathing exercises alone are not going to fix the whole problem. I just want to make sure that this is clear. Now, so the clean, practical message for this section of this podcast is that for longevity, the best blood pressure is usually not just the normal number, it's really low normal, stable, and blood pressure that's naturally achieved whenever possible. So blood pressure is around 110 to 120 over 70 to 80 is very strong zone to live in, sort of in quotes, for long-term vascular health. But medication should be used based on really total risk, not just some kind of vanity numbers. If blood pressure is truly high, treating it is one of the most proven ways to prevent stroke, heart failure, kidney disease, dementia risk, and early death. If blood pressure is only mildly elevated, and then in that case, basically the smartest first move is usually to improve the system that created it, right? Is it lack of fitness? Is it poor sleep? Is it body composition problem? Are we overweight, right? Is it the potassium-rich whole foods that's missing in our diet? Is it high alcohol intake, stress load? Those are all things that should be looked at first. Now, let's talk about a couple more things. There's something that is very useful, but most people never hear about it. And that's that regular blood pressure reading is basically containing a lot more information than just the high or normal values. For example, your top number and the bottom number let you estimate a couple of simple markers that act like a clue about your blood vessels. One is your mean pressure, often called the mean arterial pressure, or MAP, which is basically your average push. What's the pressure that's keeping the blood moving through your organs between beats. Now, before we talk about how can you easily get this number, Let's talk about what is the normal MAP. And this is where we have to be careful because MAP has two different meanings depending on a context. Now, in a hospital settings, especially in shock or critical illness, we worry when the MAP drops too low, because the organs may simply not get enough blood flow. AMP below about 60 to 65 is usually where perfusion becomes a concern, especially if it lasts or for extended period of time, or if the person is symptomatic. Now, for longevity purposes, it's a different story. For longevity and long-term vascular health, the more useful question is different. The question is not, is my MAP high enough to keep me alive today? The question simply is, what pressure is my brain, kidneys, heart, and arterial lining actually living under year after year? A common physiology range that you will see is roughly somewhere around 70 to 100 of millimeter of mercury. But that does not mean that MAP of 99 is just as good as MAP of 85. For long-term prevention, lower normal is generally better as long as the person feels well and does not have dizziness, fainting, kidney injury, or poor exercise tolerance. So blood pressure like 110/70 gives you MAP of about 83. That is usually a very favorable low normal pressure. Blood pressure like 118/74 gives you MAP of about 89. That is still a very nice range. But if someone is averaging 128/82 at home, the MAP is about 97. That number is not an emergency and it's not something to panic about, but it does tell you that the body is living under higher average pressure than ideal. So a useful stress level way to think about this is basically that MAP in the low 80s to high 80s is usually a strong, healthy vascular zone for a healthy adult. Around 90 to mid 90s is sort of like the yellow light zone, specifically if it is persistent number that you are seeing in this range. Around the upper 90s or above 90s, or even higher than that, is usually reflecting a true blood pressure burden, even if the person feels perfectly fine. And over 100, especially if it's repeated, that usually means that the average pressure load is clearly too high for long-term vascular protection. Now, this changes obviously with age. In young adult, high normal MAP should not be ignored just because they are young and look healthy. That's something that we also have to talk about because cohort data that we have gathered suggests that young adults with rising or persistently higher MAP over time have actually higher cardiovascular risk later on in their life. So for a 25-year-old or 35-year-old, the message basically is that we should really focus at this point on prevention. MAP in the mid to upper 90s is not emergency, but it may be early warning sign that their blood pressure trajectory is really moving in the wrong direction. So the goal at that age group is usually not medication first, but it's to prevent that pressure pattern from becoming their new baseline for the next 20 or 30 years. Now, in the middle age, the MAP becomes even more useful because this is when lifestyle, vascular stiffness, visceral fat, sleep, alcohol, stress, and insulin resistance really start showing up in the numbers. Middle-aged person who is living with their blood pressure somewhere at 118/74 is sending a very different signal than someone living with blood pressure about 132/86. Both people may feel fine, but the second person has much higher average pressure load every day. In older adults, their interpretation becomes more nuanced. As the arteries stiffen with age, the systolic pressure and pulse pressure often rise, and the mean arterial pressure, the MAP, can rise too, although in later life, the systolic number and the pulse pressure often become more important than the MAP alone. Also, older adults are more vulnerable to pressure dropping too low when they stand, especially if they are on medication, the orthostatic hypotension. So in older adult, lower is not automatically better. The goal is really controlled pressure without dizziness, falls, confusion, kidney injury, or general weakness. Now, athletes are another special group. Well-trained endurance-type athlete may naturally run a lower resting MAP because of stroke volume, vascular function, and autonomic tone, which are very favorable in this group of individuals. Now, if that person feels good, performs well, and has no orthostatic symptoms, a low normal MAP is usually not a problem. But athletes are not immune to hypertension. Some strength dominant or static type athletes can really run higher resting blood pressures, and older master athletes can still develop hypertension with age, especially when they stop doing what they used to do, live the lifestyle that they used to live. So the label, quote, athlete should not be used to dismiss repeated high readings, okay? Now, the real impact of bad AMP is simple. It's a pressure load marker. Too low, especially if it's in an acute setting, can threaten perfusion to brain, kidneys, and heart. Now, again, we're talking about people who are hospitalized, okay? In people with too high chronically, that means that the arterial wall, heart muscle, kidneys, and small vessels in the brain are constantly working against more pressure than they should. And over time, that contributes to vascular remodeling, left ventricular hypertrophy, okay? The left side, left ventricle of your heart basically become enlarged and thicken. Kidney damage, stroke risk, higher, and all of this basically leading to higher cardiovascular event risk. Now, can lifestyle improve the MAP? Yes, but it's usually because lifestyle improves the two things that create MAP, cardiac output and vascular resistance. You already heard the big interventions earlier. Aerobic fitness, strength training, body composition, the DASH style food pattern, right? The dietary approaches to stop hypertension, which also includes the potassium-rich foods, sleep quality, alcohol reduction, and stress control. So MAP is not a separate lifestyle target. It is more like a summary signal showing if the whole body pressure system is moving in the right direction. So the practical takeaway for this section is not to be really obsessing about one calculated MAP number. Basically track the pattern. If your MAP is usually in the 80s, that is generally a good sign. If it's usually in the 90s, especially the mid to upper 90s, pay attention. And if it's repeatedly around 100 or higher, that usually reflects too much long-term pressure load. And if it's low, but you are dizzy, fainting, feel weak, confused, and even dropping, the blood pressure dropping when you are standing, then the issue is not longevity optimization anymore. The issue is perfusion and safety. If someone wants the easiest way to get these numbers without looking up the math or doing the math, there are free calculators where you just type your top and the bottom number, and it will basically spit out the MAP, the map. For example, one such calculator is MD Calc. Another one is MAP Page on Omni, OMNI calculators. Now, let's talk about another thing that you can get from the regular blood pressure reading. And that's the gap between the top and the bottom number, which is often called the pulse pressure. Think of it as basically how much punchy each heartbeat is against the blood vessel wall. As the arteries get stiffer with age or long-term pressure damage, the gap between those two numbers often gets wider because the vessels don't cushion the pulse as well. Now, the big studies have found that higher pulse pressure is tied to higher risk of cardiovascular events and death, especially in midlife or older ages. So let's look at specific example. For example, the same blood pressure 128/82 in a man has a pulse pressure of 46, right? 128 minus 82. If a middle-aged woman has blood pressure 110/78, her pulse pressure is 32, which is less punchy. If someone is running blood pressure 150/80, the pulse pressure is 70, which is a lot more sort of like a hammer-like pressure. And that pattern is often a sign of that the arteries are not absorbing the wave as well as they used to. Again, it's a clue, not a diagnosis. So what is normal pulse pressure? Simple textbook answer is around 40. So if someone is 120/80, the pulse pressure is 40, right? In real life, pulse pressure is somewhere around 30s to 40s. And it's usually pretty normal range for many healthy adults. Once it starts moving into the 50s, that is more of a yellow light range. And once it's repeatedly around 60s or higher, especially in older adult, that becomes more concerning because it often reflects stiffer arteries. But again, age matters a lot here. In younger adult, pulse pressure is usually less useful by itself than the top and bottom numbers of the blood pressure. Young person can sometimes have a slightly wider pulse pressure because they have a strong stroke volume, especially if they are athletic. For example, endurance athlete may have a lower resting heart rate, stronger pumping per beat, and lower diastolic pressure, the lower number of the blood pressure, which can make the pulse pressure look wider without necessarily meaning disease. So in young, healthy athlete, a pulse pressure in the 50s is not automatically scary if the overall blood pressure is good and there are no symptoms. But that same number means something different in 65 or 75-year-old. In older adult, pulse pressure becomes more important because it often tracks with arterial stiffness, as I already mentioned. As the aorta and large arteries lose their elasticity, right, the ability to expand and contract, they do not absorb the pressure wave as well. The systolic number, the higher number of the blood pressure, goes up, and the diastolic number may stay the same or even fall, and the gap gets wider. And that is why the blood pressure like 120/80 is not just the top number is high. It's also a pulse pressure of 70, which tells you that the arteries are getting hit with a much wider pressure wave every beat. The people where the pulse pressure matters most are really older adults, people with isolated systolic hypertension, where only the higher number of the blood pressure is elevated and the lower may be somewhere in normal range. Also in people with known cardiovascular disease, chronic kidney disease, diabetes, or long-standing hypertension. In those groups, wide pulse pressure is not just math curiosity, so to speak. It has been linked with higher risk of coronary disease, heart failure, stroke, kidney disease, cognitive decline, and mortality. Now, a narrow pulse pressure can also matter, and that's a little bit different story. If the gap is very small, especially less than 25% of the systolic number, it may suggest low stroke volume or poor cardiac output in the right clinical context, right? Now, that is more of an acute or disease-related concern, specifically if the person is weak, has shortness of breath, feels dizzy, is cold, clammy, or clinically unstable. For the average healthy person, checking blood pressure at home, the more common long-term issue is not really the narrow pulse pressure, it's really the pulse pressure that's slowly widening with age as the vascular stiffness is becoming more pronounced. So practical way to say this is that around 40 is a classic healthy pulse pressure. The 30s and 40s is usually reassuring. The 50s is where it starts to deserve the context that we're looking at, right? And around 60 or higher, especially after the age 60, that is stronger signal of vascular aging or arterial stiffness. Around 70 or even higher, that is more concerning and should make you look closely at the systolic blood pressure, the diastolic pressure, kidney health, diabetes risk, smoking history, exercise pattern, and the overall cardiovascular risk. Now, can lifestyle improve pulse pressure? Yes, but not as a separate magic target, right? You do not usually treat pulse pressure directly. You improve the system that creates it. The systolic pressure, arterial stiffness, vascular tone, metabolic health, sleep, and inflammation. So the same foundation that we already discussed, basically fitness, strength training, body composition, the DASH style eating, again, potassium-rich whole foods, alcohol reduction, sleep quality, and obviously not smoking. This is also the practical foundation for keeping pulse pressure from widening too early. So basically, all these interventions will affect, as you could expect, all these measures that we have been discussing individually. So the main takeaway is this: pulse pressure is not something to really obsess over for one reading. It is again pattern maker. If your pulse pressure is usually around 35 to 40, that is generally a good sign. If it's often in the 50s, look at the whole picture. And if it's repeatedly 60s or higher, especially in a middle age or older age adult, it may be telling you that your arteries are becoming less elastic and that your systolic pressure load is too high. Now, that matters for longevity because vascular aging is one of the main ways that the body quietly moves towards stroke, heart failure, kidney disease, and loss of function. Now, if people want to calculate this instantly, any pulse pressure calculator works because it's literally just subtraction. There are simple ones online where you just again enter the blood pressure number and it shows the gap. Now, there's also a third hidden message in the blood pressure reading, and that's how steady your numbers are over time. If your blood pressure is all over the place from day to day, even if the average is not really terrible, that bigger swing has been linked to higher cardiovascular risk in multiple studies. In plain terms, your body likes steady pressure, and big ups and downs can be rough on the vessel linings. That's one of the reasons why one random reading doesn't really tell you the whole story. You care about the average trend and the stability across many readings. So let's look at what swingy blood pressure looks like in real people. For example, 45-year-old guy might log in the morning blood pressures like 118/76, 136/86, next day 124/80, and a few days later 142/92, depending on sleep, stress, caffeine intake, and salt. While his friends stay clustered around 122/78, next day he may have 124/80, then it might be 121/77 or 123/79, and so on. So even if the averages are not wildly different, the worst pattern is more, quote, sort of like spiky, right? You can say. The research papers measure this with math terms like standard deviation across the visits. But the street level version is very simple. If your home numbers jump around a lot for no clear reason, that's a signal to tighten up measurement habits and look for lifestyle triggers, because the variability itself has been tied to risk in several meta-analyses. Now again, if someone wants to help doing the basic averaging, there are online tools where you paste several readings and it gives you the average blood pressure. For example, the American Medical Association has blood pressure average calculator, and there is also self-measured blood pressure average calculator on Target BP. Now this is also why some home blood pressures reading can be so revealing. A lot of people look fine in a clinic and run high blood pressure at home. That's referred to as masked hypertension. And on the other hand, you may have some people that have blood pressure that is spiking at the clinic, but maybe normal at home. I had several of these patients. When the nurse took their blood pressure at the clinic, it was always around 150, which was really concerning. But they would tell me that at home, their blood pressure was in 120s. Not great, but still a lot better than what we measured at the clinic. This kind of pattern, when the blood pressure is elevated only at the clinic and not at home, is referred to as white coat syndrome. And that's because someone figured that the doctors wearing a white coat would make people nervous. Now, these days, lots of doctors don't really wear the white coat, but just the fact that the patient is at the clinic and not at home can make them more nervous. Now, there was a meta-analysis, in other words, study of many different studies that showed that home blood pressure tends to actually predict cardiovascular outcomes better than the blood pressure that we take in the office. And it's again because it reflects your real life more than the stressful moments in a chair in your provider's office, right? So you may have 50-year-old woman who can have blood pressure 118/76 in the clinic, but average 135 over 85 at home when she is juggling work, stress, and poor sleep. That's not just the nerves. That's her real baseline, because in her real environment, that's what her blood pressure looks like. Or you can have 47-year-old guy who might hit 145/90 in a clinic, where he basically was rushing, was anxious, but when he sits around at home, his blood pressure can be around 123/79. And that's the opposite story. So if people want a simple, legit way to track home readings, the American Heart Association has actually printable blood pressure logs. The log basically tells you exactly how to take two readings, 1 minute apart, twice a day for several days, so you can see your true blood pressure pattern. Now, one last blood pressure trick, which gives you a little extra information about your system. So take a reading after you've been laying down or sitting quietly, and then again after standing for about a minute or two. If your blood pressure drops a lot when you stand, that can be a sign that your body is struggling to keep steady flow to the brain when the gravity hits your body. Now, there was a large meta-analysis that linked this phenomenon, which is called orthostatic drop, to higher risk of bad outcomes over time. Now, the reference numbers that people are always asking about here are pretty concrete, and they come from long-standing studies and agreements of what's normal. So, for example, a drop of about 20 points on the top number or 10 points on a bottom number within 3 minutes of standing is a classic cutoff that is used in research and clinical definitions. Real middle-age example would be, for example, 55-year-old man who has blood pressure 132/84 while sitting. And then after standing is about 108/72. That's a 24-point systolic drop, which means the classic definition. Another example could be 49-year-old woman who has blood pressure 120/78 while she's sitting, and when she's standing, it's gonna be 112/74. That's about 8 points of systolic drop, which does not really meet the usual cutoff. The point is not to label yourself, right? It's to notice a repeat pattern of big drops, especially if they match symptoms like lightheadedness. Now, another timing pattern that people frequently miss is what happens while you're asleep and right after you wake up. Now, in healthy pattern, blood pressure usually drops during sleep because the nervous system is supposed to shift into more relaxed recovery mode. That drop is called the night dip. A normal dip is roughly 10 to 20% lower than the average daytime blood pressure. But some people do not dip much at all, and some people actually run higher pressure during sleep. That matters because nighttime is when the cardiovascular system is supposed to get a break. If the pressure stays high all night, the brain, kidney, heart, and blood vessel are still being exposed to pressure stress while the body is supposed to be recovering. Now, most people cannot fully measure this with a regular home cuff because, be honest, they are asleep, right? But morning blood pressure can give you a clue. Blood pressure naturally rises around the time when we wake up. But if your morning readings are consistently much higher than your evening readings, that is not just random noise. It means that your blood pressure is running, is basically surging too strong in the morning. Or it may mean that your pressure really never dropped properly overnight in the first place. So practically, how would a normal person use this? Don't judge it basically just from one morning readings. That's step number one. For 1 week, take 2 readings in the morning and 2 readings in the evening, about 1 minute apart, and compare the averages. The morning reading is usually best taken before you drink any caffeinated drinks, before any exercise, breakfast, or before you take any morning medication, because you really want to see what your body is doing when you first wake up. Now, if the morning average is repeatedly high, especially around 135/85 or higher at home, or if it is consistently much higher than the evening number, that pattern is worth paying attention to. It can really point towards poor sleep, untreated sleep apnea, too much alcohol in the evening, or even late heavy meals, high salt intake, chronic stress, kidney disease, diabetes, that's especially not uncontrolled, and blood pressure medication that is not basically providing full coverage throughout the night. So the key point is this: morning blood pressure is not just another random number. It can be a window into your overnight physiology, sleep, such as sleep quality, nervous system tone, medication coverage of, especially for the blood pressure. So go back to our discussion. Whether your blood pressure is dipping or not overnight is significant, okay, and we should pay attention to that. And again, if you notice pattern where you see that it keeps showing up, that your morning blood pressure are consistently elevated, the best test to clarify it really is to have a discussion with your provider about doing 24-hour ambulatory blood pressure monitoring, because that can actually show what happens during sleep and around the time when you are waking up. Now, another subtle thing that people frequently miss is timing. Blood pressure often rises in the morning, around the time we wake up, and for some people, that morning surge is exaggerated. Research using 24-hour monitoring has linked stronger morning surges and abnormal day-night patterns with higher cardiovascular risk in at least some populations. The big takeaway for normal person is simple. If your morning blood pressures are consistently higher than your afternoon, that's a real signal, not just random noise. And it's worth tracking as a pattern over weeks. Now, why are we really talking about this not so sexy longevity indicator such as blood pressure? Because the goal of getting your blood pressure lower can really save your life. But there is also trade-off. Sometimes pushing blood pressure very low can cause side effects or other issues. That's the real adult conversation that every patient has to have with their provider. We have to look at the benefits versus the risk of our specific bodies, right? People love to talk about anti-aging pills and fancy science, but really keeping our blood pressure in check is one of the most proven anti-aging tools that we have. This is frequently because aging often looks like your organs are failing or that you are having a major health disaster like a stroke. So controlling your blood pressure stops that from happening. So to wrap it up, high blood pressure is a massive risk for your heart and brain, and really treating it works, period. No question. The only question that there is the best way to do it so that it works for you. Now let's talk about the fourth bucket, and that's your metabolic health. This is a topic where things usually get pretty messy because the internet turns it into shouting match about diets, low carbs versus low fat, seed oils are poison or calories don't count, things like that. Now, I'm not interested in picking a side in those tribes. When we talk about metabolic health in a way that actually predicts how long we will live, we are looking at specific things. How your body handles sugar, insulin resistance, for example, right? How much fat is stored around your organs, the visceral fat, and your risk of developing type 2 diabetes. The goal is not just number on a scale. It's preventing the long-term damage to your blood vessels and the heart that happens when your metabolism starts to break down. Now, one of the most powerful examples of how much control you have over this is the Diabetes Prevention Program. This was a massive study showing that simple but structured lifestyle changes like better food choices and moderate movement reduce the risk of developing type 2 diabetes by over 50%. It actually worked better than the common diabetic drug metformin. This tells us that prevention is incredibly effective. However, it gets complicated once the disease is already established, right? When we already have diabetes, it's a little bit different. Now, a study called the Look Ahead showed that even when people with type 2 diabetes lost weight and got more fit, right, it didn't always automatically lower their rate of heart attacks or stroke during that study. This is a humbling reminder that even though lifestyle is crucial for our quality of life and energy, the further you move down the path of metabolic disease, the harder it is to undo the vascular damage that has already started. Now, recently we have seen a massive shift in how we can protect people who are at high metabolic risk, specifically through new medications like GLP-1 receptor agonist. You have likely heard the names like semaglutide. Now, a major trial called SELECT showed that for people with obesity and heart disease, but without diabetes, these medications significantly reduce major heart-related disasters. This is not just weight loss for vanity. It's heart outcome benefit that directly impacts your lifespan, period. We also see strong evidence from bariatric surgery, long-term data showing that for those with severe obesity, surgery often leads to lower risk of early death and fewer heart problems compared to non-surgical treatment. Now, obviously, these treatments or procedures are not right for everyone, and they certainly have risk. They do show that when lifestyle is not enough, we have medical tools that can still stack the deck back in your favor. Now, from a practical longevity standpoint, your best move really is to prevent type 2 diabetes before it starts because the evidence for preventing is rock solid. Now, if you already have metabolic issues, improving your fitness and weight still matters, really does matter for your day-to-day health and how you feel, even if the heart benefits take longer to show up in the data, right? Now, we use these medical and surgical tools because heart disease and metabolic failure are two of the biggest ways that our lifespan and health span get cut short. So keeping your metabolism healthy is about keeping your body's internal chemistry from corroding your heart and brain over time. So let's look at the boring foundation that everything sits on. So if you want the honest map for long life, the one that's based on facts rather than trends, the foundation is very clear. You need consistent exercise because it's the most durable predictor of a long life that we have. You need to focus on both your cardio fitness and your muscle strength. You also need to quit smoking if you haven't already, since that's one of the biggest interventions that you can implement to stop doing active harm to your body right away. You also need to keep your blood pressure in that optimal zone to protect your organs from constant mechanical stress. And finally, you need to stay on top of your metabolic health to prevent your system from developing the complications that come along with diabetes. Now, here is the most important part. None of this is the end of the story, but is the absolute base that you must build on. If your blood pressure is out of control, if you are sitting on a couch all day and your metabolic risk is climbing, spending time and money on fancy supplements or biohacks is like trying to optimize your paint job on a car while the engine is literally on fire. You have to get the basics right first. Once you have this core evidence-based foundation in place, then we can talk about the frontier of the science, the things that are promising, the things that are overhyped, and what might actually add more years to your life beyond these fundamentals.